Hi, hello everyone. Welcome to Dr. Ravichandra official YouTube channel, exclusive channel for pathology. In the last video, we have discussed RBC abnormalities and WBC abnormalities. In the present video, we will discuss the platelet abnormalities and platelet disorders. Let's start the video. Platelet anomalies morphologically, they can be giant platelets, platelet clumping can be seen, and platelet satellitism. Giant platelets, they indicate the premature release from the bone marrow due to increased demand. Usually, they will be bigger than a RBC. Normally, the platelets will be less than the RBC size, but in the giant platelets condition, these platelets will be bigger than the RBC. And giant platelets are seen in giant platelet syndromes. Platelet clumping causes will be slow venipuncture, EDTA induced platelet clumping also seen many times, and if the sample is collected 24 hours earlier, that is if the reporting is getting delayed, then there will be platelet clumping in the samples. And there is a condition called as Glanzmann thrombosthenia in which also platelet clumping can be seen. The platelet clumping in the picture can be shown using blue arrows. Platelet threads, these are the activated platelets and they will have spider-like or thread-like projections and fibrin threads. Platelet satellitosis. This is a phenomenon of adherence of the platelets to white blood cells. This is a in vitro phenomena and it has no clinical significance. Platelet satellitosis is seen in pseudothrombocytopenia. Now coming to platelet disorders. The platelet disorders can be classified into hemorrhagic, thrombotic, quantitative, and qualitative. Platelet disorders, hemorrhagic. Hemorrhage means severe bleeding. So it can be localized or generalized or acquired or congenital. Localized is pertaining to single location. Generalized means multiple sites are involved. There will be spontaneous recurrent bleedings from these sites. Acquired is developed in the latter because of some deficiencies like vitamin K deficiency. And congenital, which is very uncommon, and examples are von Willebrand disease and factor 8, 9 deficiencies. Factor deficiencies. Factor 1 deficiency will cause afibrinogenemia, and factor 8 deficiency will cause hemophilia A, and factor 9 deficiency will cause hemophilia B, and factor 11 deficiency will cause hemophilia C. Thrombosis, it is inappropriate formation of the platelets or fibrin clots that will obstruct the blood vessels. You can see the blood clot in the picture in the veins. Disseminated intravascular coagulation, also called as consumption coagulopathy or defibrillation syndrome or DIC. This is generalized activation of the hemostasis mechanism and it is secondary to systemic diseases. It involves all hemostatic systems and there will be formation of microthrombi. Fibrin microthrombi will partially occlude the small blood vessels and they will consume all the platelets and coagulation factors and fibrinolytic enzymes. Now we will discuss platelet disorders which are quantitative. Thrombocytosis, that is increase in the circulating platelet. Normal platelet count will be 1.5 to 4 lakhs. If the platelet count is more than 4 lakhs 50,000 per microliters, then it is called as thrombocytosis. And reactive thrombocytosis is a condition seen secondary to other conditions. Thrombocytopenia is decrease in the circulating platelets less than 1 lakh per microliters. And Bleeding, common presenting symptoms will be there will be mucocutaneous bleedings, petechiae, purpurae, ecchymosis, epistaxis, and gingival bleeding. Coming to reactive thrombocytosis seen in blood loss and surgery, splenectomy, iron deficiency anemia, stress or exercise. And myeloproliferative disorders with thrombocytosis are seen in polycythemia vera, chronic myelogenous leukemia, myelofibrosis with myeloid metaplasia, and essential thrombocythemia. This is a picture showing essential thrombocythemia blood film. So, decreased production is causing Bernard-Soulier syndrome. There will be giant or large platelets, and in Wiskott-Aldrich syndrome, there will be small platelets. And increased destruction causing thrombocytopenia is seen in thrombotic thrombocytopenic purpura, also called as TTP, and hemolytic uremic syndrome, HUS. Qualitative platelet disorders, thrombocytopathy, that is, there is change in the platelet function. Platelet aggregation disorders, example, Glanzmann thrombasthenia. Glycoprotein 2b by 3a is defective. Platelet adhesion disorders, example is Bernard-Soulier syndrome. Glycoprotein 1b is defective. And disorders of platelet secretion, sorry, excretion, not secretion, it's secretion. Disorders of platelet secretion, storage pool diseases like Hermansky Pudlock syndrome. There will be Swiss cheese platelet appearance. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos.